Castration for cure of homosexuality. There was a time in medical history when if you were a dude who likes another dude, you'd be considered mentally ill. This was during the middle of the 20th century, when being gay means you're not right in the head, and that's why they employed questionable methods to cure it. This wasn't just some lone wolf doctor with a crazy theory, instead it was a widespread practice. Psychiatrists worldwide slapped the pathological disorder label onto homosexuality like it was just another seasonal flu. The treatments varied from slightly irritating to literally shocking the gayness out of them by zapping them with electricity. However, in certain cases, doctors recommended a more radical approach by going straight to the source and snipping it out. Their solution was castration. The idea was that removing a man's testicles reduces testosterone, the male hormone, and somehow eliminates homosexual desires. Imagine being told that an essential part of who you are isn't just wrong, but also detachable. It's like getting a mechanic to fix your car by removing the engine. In some places, if you were convicted of homosexuality, the choice was jail or castration. It was a choice that made you feel like you were between a rock and a hard place. But castration didn't work, and victims were left feeling like they lost a part of themselves down there. Tooth extraction for madness. Let's say you're having one of those days where your mood is a little off, and your mind's got you on the ropes. But when you head to the doctor expecting some helpful words, or maybe a pill or two, he suggests taking out every last one of your teeth. It sounds absurd, but back then, some doctors believed that yanking out your molars could also yank out the madness. The belief that tooth extraction surgery could cure madness is connected to a theory called focal sepsis. It says that infections anywhere in the body, especially in the teeth, tonsils, and sinuses, could spread and cause mental illness. Doctors figured that by removing those pesky infection-ridden parts, they'd also be evicting the mental illness along with them. Snip out the problem, snip out the madness, they thought. Imagine asking for a second opinion and getting a first opinion that your incisors might be harboring your anxiety. This process involves being restrained while the doctor removes your teeth, all without the help of anesthesia. Sometimes they pull all your teeth at once. Imagine the haul you would get from the tooth fairy. The only problem is you'll be left toothless, and there isn't a guarantee that you'll be right in the head after that. Unsurprisingly, many people found themselves toothless and unable to eat solid food because of a theory that didn't have solid evidence. So by the 1940s, extreme tooth extraction practice fell out of favor. After all, it's already hard enough to suffer from mental illnesses. Adding dental mutilation to the list of problems would only put life in ultra-hard mode. Hemoglossectomy. You know, your tongue isn't just an essential muscle that's there to taste some of Gordon Ramsay's finest dishes, but also to help you speak and swallow. Now imagine having a chunk of that essential muscle removed. That's a hemoglossectomy, or partial tongue removal. It's not the spa day your tongue had in mind, but it's one of the more intense surgical procedures usually performed to treat tongue cancer. The tongue is this amazing, flexible bundle of muscles that helps you communicate, chew, and swallow. For people with tongue cancer, though, parts of this muscle may become cancerous. So if your tongue has been moonlighting as a cancer hotspot, it's time for the doctors to step in and do some cleanup. During a hemoglossectomy, surgeons remove a part of the tongue, typically the half that's been affected by cancer. As you might expect, removing any part of the tongue isn't exactly easy. It's a delicate dance of preserving enough tissue to still talk, taste, and swallow without constantly feeling like your tongue has suddenly gone MIA. Surgeons must carefully work around nerves, blood vessels, and other structures that make the tongue so effective at its many jobs. It's a high-stakes game of tongue Tetris, except you're avoiding vital body parts instead of blocks. After the procedure, patients usually need speech therapy to help retrain their remaining tongue to handle the speaking and swallowing. It's like retraining a puppy, but instead of fetching, you're teaching it not to trip over its words. There's also an element of reconstruction where they might use tissue from other body parts, such as the thigh muscles, to rebuild some of the tongue's lost volume. So if you have thick thighs you want to trim down, you're in luck. Symphysiotomy. Being a pregnant woman about to give birth to a big baby used to be the stuff of nightmares, like a low-budget horror movie where the baby's head is the villain. Today, when the baby's head is a bit too big for normal delivery, doctors have their trusty C-section procedure to get that little guy out of the womb. But before modern medicine got its act together, doctors had a more brutal idea called symphysiotomy, which was very popular in Ireland from the 1920s to the 1980s. It was the go-to horror show for mothers-to-be who thought childbirth couldn't possibly be any scarier. Symphysiotomy involves cutting through the cartilage and ligaments of the pubic symphysis, basically the joint that holds your pelvis together like a puzzle piece. This isn't some dainty incision because it essentially splits your pelvis apart to make more space for the baby. To make things worse, this was often done without adequate anesthesia, meaning women were in severe pain during the procedure, which sounds like a medical nightmare in 3D. This surgery could result in extreme long-term complications. These ladies suffered from lifelong pain, a gait that made them look like a jelly-legged flamingo, and an endless wobble that made even sitting feel like an extreme sport. Many women experienced urinary problems, difficulty with future pregnancies, and lifelong mobility issues. Some doctors believed it was less risky than a C-section, especially in rural settings where surgical facilities were as rare as Wi-Fi in the mountains. C-sections were often seen as a one-way ticket to family size reduction. Meanwhile, symphysiotomies allowed a woman to keep having children, which was important to some religious groups that wanted families to go forth and multiply. Today, symphysiotomy is largely seen as a historical atrocity. Most countries abandoned it in favor of C-sections and safer childbirth practices. After all, if you have cutting-edge technology, there's no need to cut through your pelvis. Tooth in eye surgery. If you can say I can't say that. If you can say osteodontokeratoprosthesis, hats off to you. But we prefer calling this procedure the tooth and eye surgery because that's what most people call it. Now, you may be wondering what this surgery is about. Imagine needing a new way to see and finding out the solution is putting a tooth in your eye. Sounds like a medieval prank, but tooth and eye surgery is real. First, an eye surgeon extracts one of your teeth, root and all. You'd think this is the part where they pull out a random tooth, but nope, it has to be your tooth because the body is like a picky eater that prefers its own cooking instead of someone else's food. This tooth becomes a support structure for an artificial lens that will eventually sit in your eye. But before anything gets put in your eye socket, the tooth-lens combo needs some prepping. The surgeon shapes it into a little window frame for the lens, giving you a unique kind of tooth glasses in a way. Once that's done, your tooth and its new lens, BFF, are implanted in your cheek for a few months to grow blood vessels. This step helps your body accept the tooth as part of your eye area, which is why it's nestled in your cheek like a guest at a bed and breakfast. After it's nicely embedded and ready, the implant is transferred to your eye socket. Ultimately, the lens pokes out of your eye, allowing light to get through and restoring a degree of vision to people whose corneas are damaged beyond repair. It sounds like the kind of procedure that could only come out of a sci-fi movie, but it's been a lifeline for people who've exhausted other options for seeing again. Flesh hooking. Let's say you're back in medieval times, where medical knowledge is still brewing and treatments can feel like nightmare fuel. You've got a nasty wound or abscess, a pocket of pus that's painful and needs to drain. Nowadays, a quick visit to the doctor would have you cleaned up and patched with minimal fuss, but back then you'd get to experience the delightful world of flesh hooking. This surgery was essentially a procedure that involved hooking the flesh around a wound or abscess and pulling it to drain the infection. Picture a small curved metal hook. This hook would be plunged into the skin around the wound or abscess, twisted to get a good grip, and then pulled back to create an opening. It's like fishing, but instead of catching dinner, you hope not to catch an infection. The aim was to allow the pus or infected material to escape, as draining it would hopefully prevent the spread of infection. But you can imagine the process was brutal. There were no anesthetics, so pain was the star of the show, with screaming in agony as the best supporting actor. Aside from the sheer horror of having someone hook and pull your skin like it was a fish being reeled in, the risk of infection was sky high. Hygiene wasn't exactly a priority in those days, so introducing an unsterilized hook into an already infected area was like adding gasoline to a fire. Unsurprisingly, complications were common, leading to blood poisoning or gangrene. It's like trying to fix a flat tire by throwing more nails at it. This procedure wasn't exactly a top-tier medical solution, but back in the day, it was considered a necessary evil, the medieval version of better than nothing. If they could drain the poison, you'd have a fighting chance. Unfortunately, more often than not, it turned a nasty wound into a full-blown disaster. Cataract couching. Imagine living in ancient Egypt and your vision starting to blur like someone smeared Vaseline on your eyeballs. Turns out you've got cataracts, a condition where the lens of your eye becomes cloudy. Nowadays, doctors can fix it with a simple high-tech procedure, but back in the day, you'd get a treatment called couching, a technique that's as unpleasant as it sounds. Couching is one of the oldest recorded eye surgeries, dating back over 2,000 years. The process was simple but brutal. Often using a sharp metal or bone needle, a healer would poke took your eye and pushed the cloudy lens down out of your sight. Yes, they basically shoved your cataract out of the way, but couching didn't actually cure cataracts. Instead, it just moved the problem. It was like sweeping dust under the rug and calling it clean. But that didn't solve the issue. With the lens out of your line of sight, you'd go from being unable to see anything to seeing something, but it wasn't exactly HD. Since the lens helps focus light, losing it left patients with serious vision issues. It was like permanently viewing the world through a bad Instagram filter. And don't forget, this was the time of zero antibiotics and no knowledge of germs. Pain and infection were all part of the package deal. Many people ended up blind, either from the trauma of the procedure or from the inevitable infections. But couching remained popular for centuries, used by civilizations from the Greeks to the Chinese, because it was better than nothing. People were desperate to see again, even if it meant risking a hands-on approach to eye care. Facial reanimation surgery. It's the 1800s, and you get into a nasty accident that left you with some facial trauma. Your face can no longer move the way it should, like you had an unwanted dose of Botox. No smiles, no frowns, because it's just a stiff, frozen expression. But there was a 19th century fix for that. Doctors of the day were still figuring out this whole surgery thing. Surgery, yes. Which sometimes meant guesswork with extra steps. They aimed to get your face back to its expressive self using nerve grafts to connect healthy nerves from your arm to your cheek. The idea was to get your facial muscles moving again, but it wasn't exactly a smooth operation. Sometimes the nerves wouldn't grow in the right places, and infection was a huge risk. Imagine having surgery to make you look normal again, but instead you might just end up with more pain, or worse. Other surgeons would try muscle transplants from other parts of the body, but that didn't quite work out either, as the muscle often rejected the transplant or didn't function properly. Sometimes the reanimation wasn't always a success. Patients could end up with bizarre, mismatched expressions, like a wax figure left out in the sun too long, or worse, with no change at all. Although it was a first step toward modern facial reconstruction, facial reanimation surgery was a procedure you'd want to avoid unless you were committed to that living statue aesthetic. Let's just say in the 1800s, you'd walk away from surgery not looking like yourself, but more like a poorly assembled mannequin. Surgical treatment for hysteria, Victorian era. Let's take a trip back in time to the Victorian era, where one of the weirdest and most horrendous treatments they had was for something called hysteria, a condition that was diagnosed if a woman was, say, anxious, emotional, or maybe just didn't feel like conforming to society's very specific expectations for behavior. These symptoms were, of course, seen as signs that a woman's womb was in distress. Basically, any emotional moment was a sign that her uterus was throwing a tantrum. The treatment was a surgical procedure that was less surgical and more like a bizarre form of medical theater. This procedure was called hysterectomy, which involved removing the uterus. Yes, the thinking was that simply removing the offending organ would fix everything. That's like trying to fix a flickering light bulb by tearing down the entire electrical system. The logic was questionable at best, but this drastic measure took hold in an era with few checks on invasive treatments. Hysterectomies back then were like a DIY home improvement project gone wrong. In an era before antibiotics, anesthesia was more good luck than science. Patients might have endured unbearable pain, massive blood loss, and a shockingly high risk of infection. There wasn't much aftercare either. If you survived the surgery, well, good for you. And if you didn't, it was likely chalked up to weakness rather than brutal medical practices. This wasn't just happening in rare cases, because doctors routinely subjected women to these surgeries, believing they were doing the right thing. Some even went further, removing ovaries, the clitoris, or other parts of the reproductive system, aiming to correct unwanted emotions or behaviors. It was like trying to fix a computer glitch by smashing the whole device with a hammer. We on this channel respect any kind of emotional outburst you may have because of your hormones, but if you want to smash something, it might be best to smash that subscribe button. Laryngeal nerve stripping for hoarseness. If you often suffer from hoarseness, it's like someone is choking you while you're talking because your voice sounds strained or breathy, like you're auditioning for a role in a haunted house. But there was a time when doctors had a very extreme solution for chronic hoarseness. It involved stripping the nerves that were causing the problem. However, there's a reason why this isn't a popular surgical treatment anymore. The laryngeal nerve, a set of nerves that controls the larynx, or the voice box, is pretty important. It controls the muscles that help you speak, swallow, or breathe. Messing with it is like running a company without telephones, because you can't communicate your message. That is why this surgery went out of fashion quickly. When surgeons tried to strip the laryngeal nerve, they weren't just getting rid of a bad signal, but were damaging the nerve itself. This led to even worse voice problems, like total voice loss, or worse, permanent breathing difficulties. Imagine trying to talk or breathe, but your body's main voice controller is messed up. It's a bit like trying to use a broken microphone, in the sense that you might get something out, but it will sound pretty terrible. The procedure was risky because it didn't just fix hoarseness, but also worsened things. Some people ended up with severe swallowing problems, making every meal feel like you're swallowing an entire elephant. And don't forget the emotional toll of losing your voice, which can be a huge part of a person's identity. The medical community ditched this surgery when the risks outweighed the advantages. After all, their patients couldn't voice out their concerns when they couldn't voice out anything at all.